We are entering the time of year that typically marks the start of cold and flu season. Research shows that getting the flu vaccine can reduce influenza illnesses by 40 to 60%. And if you get the vaccine sooner, you can help us avoid a strain on our health system. Let's learn more from one of our talented Intermountain Health physicians.
Hi, my name is Christopher Autry. I'm the Chief Medical Officer for the medical group here for Intermountain Healthcare. I'm honored to be able to join you today. Here are a few of the most common questions about the flu vaccine and answers for you to consider. First and foremost, we want you to speak with your primary care physician about what's best for you and for your health. But here are a couple of facts for you to consider when you consider whether a flu vaccine is right for you. First and foremost, a flu vaccine is relatively effective at decreasing your risk of developing influenza infection. It's estimated in 2019 to 2020, which was the first year before we had this COVID vaccination and COVID infection issue, that flu vaccination in this country prevented 7.5 million flu infections, 3.7 million internal medicine or family practice visits to your primary care physician. Flu vaccine prevented 105,000 hospitalizations and almost 6,500 deaths in this country. So flu vaccination reduces the likelihood of you getting the flu by about 50%. Unfortunately, the flu shot wears off in about 6 months. It does not provide long-lasting infection because the surface of the virus, the influenza virus, is constantly changing. And that change happens on a yearly basis. Well, we typically suggest that patients get a flu shot either in September or October before we start to see the rise of influenza infections, which generally occurs during the winter. Now, the important thing to realize is it takes about 2 weeks to get that immunity to the level where you can fight off the influenza virus after you've been vaccinated. It's difficult to predict when the flu will come through year in and year out. But September and October are generally the times of the year when it's best to get the flu to make sure that you're absolutely prepared. Well, predicting what this year's flu season will look like is difficult. And the reason for that is because we still have the COVID-19 virus still out within our community. And we know that through these past couple of years, during these COVID years, that the combination of influenza infection, flu virus, and COVID-19 is challenging. Despite the new COVID-19 vaccine boosters that we hope will be coming soon, the virus that causes COVID is still circulating within the community, and future waves could put additional strains on our healthcare system. We don't know what the next few months will hold, and if we have a significant COVID-19 resurgence and our healthcare facilities get overwhelmed, then the general public's access to appointments for the flu and other illnesses may be diminished. So really, it's essential now, during this relative quiet period, that you get the flu vaccination as soon as it's available to you. Yes, studies have shown that it's both safe and effective to get both your flu shot and your COVID-19 vaccination or booster simultaneously. The two vaccines are for two different viruses, and your body can mount a proper immune response against both at the very same time. If you experience side effects after the flu vaccine, or you've had side effects to earlier doses of the COVID-19 vaccine, you may experience similar side effects after getting both simultaneously. It's important to review your experience with vaccinations with your healthcare professional before you proceed. Unfortunately, it is true that the flu shot doesn't always work. With that said, what we know is that the flu vaccine globally, and if we look at years and years of of experience with the flu vaccine, it has proven to be very effective at reducing the likelihood of becoming infected. Thanks so much for joining us.